Hi, everybody. My name is Maddie. I'm here to talk to you about substance abuse, depression, and the impact of socioeconomic status. I just wanted to say thank you to those of you who decided to watch my presentation. I really appreciate it, and I hope you learned something valuable. I believe this topic is incredibly relevant to the topic of global mental health and public health practice in general, because opioid and illicit drug use has been an increasingly hot topic over the last decade. And as future public health professionals, we must focus on continued prevention and treatment interventions that are targeted at the relevant social determinants of health that fuel this crisis. Whether we're working in developing countries or here at home, substance abuse in relationship to depression and mental illness is a field that needs more attention and outreach efforts. So thank you for watching. So as an introduction to the topic, I think it's important to understand the global burden of mental illness in general, because universally, mental illness remains a top priority for mental health officials, as well as international aid organizations, as tremendous mental health disparities still remain, regardless of the advancements we have made in the treatment and prevention of mental illness. For example, according to the World Health Organization, 1 in 4 people worldwide will suffer from a mental illness or neurological disorder at some point in their life. This totals around 450 million people. However, of this population, only 1/3 of individuals will receive the proper treatment from a medical professional for their diagnosis. So there's a big gap between the number of people that have been diagnosed and those that are receiving proper treatment. Research suggests that this may be due to the barriers, potentially, fear of discrimination, stigma, and neglect. And by neglect, they are referring to a lack of understanding regarding mental illnesses and mental health in general. And this lack of understanding, in turn, becomes neglect, and neglect will become a lack of understanding. And so it's kind of like a cyclical cycle. Further, lack of proper mental health infrastructure has likely played a role as well, as the World Health Organization cites these statistics from 2001, so they are a bit dated, but I believe they're still relevant and shows how big of a disparity remains between mental health disorders and primary care, because greater than 40% of countries had no mental health policy at this time, greater than 30 had no mental health program, and around 25% had no mental health legislation. And so while these may have likely have improved especially since the implementation of the Sustainable Development Goals, mental health and mental illness remain a priority in terms of public health and public health outreach. So here we have a visual representation of global mental health disability. As you can see, the largest contributor to disability was mental and behavioral disorders in both 1999 as well as 2010, and the percentage didn't really change very much, with contributing greater than 20% of global disability in a 20-year span. So to continue, I'm kind of breaking this down into the smaller parts of the presentation. I'm going to talk about the problem of depression. First, to introduce it, depression specifically remains the leading cause of disability worldwide. So around 20% due to mental and behavioral disorders, and the largest chunk of that is depression. According to the research conducted by the United Nations in 2017, 4% of the global population, or about 322 million people, currently live with depression. And this illness is the cause of nearly 800,000 suicides every year, with the largest proportion of these occurring in young adults between the ages of 15 and 29. So to build on this, I want to talk about substance abuse and depression. So as this visual represents, there is a prevalent association between substance abuse and depression. As it states here, around 33% or 1 in 3 people with major depression disorder or major depressive disorder engage in substance abuse. This statistic is actually cited from the results of the sequential treatment alternative to relieve depression study, which showed that 1/3 of the 4,010 patients of the cohort that presented with major depression had symptoms consistent with concurrent substance use disorders. So this is also known as the STAR-D study, and it was very provincial in its time. and provided us with a lot of research regarding the comorbidity that exists between substance use and depression. So to play on this, again, there is a comorbidity that exists between the two, but the explanation isn't necessarily clear as to why this exists. It can be explained by either a causal relationship or a shared etiology between the two disorders. In general, this is how most comorbidities in mental illnesses come to be, but little research has been done as to understand why those with depression often present with substance abuse and vice versa. So again, while a plethora of literature has supported the association between substance abuse and depression, few have studied the way in which this comorbidity comes to exist. And that's likely because the psychopathology that exhibits a very intricate relationship that results in these mental health comorbidities. And thus, it has created a lot of barriers to researching them just because of cost and time associated with this research. Okay, so now to build upon that, to talk about what we really want to discuss, which is substance abuse, depression, and socioeconomic status, and the way they're all interconnected. So here we have a visual of depression among those with lower socioeconomic status. So you can see here that there isn't, again, an association between those suffering from depression and those with low socioeconomic status. Research conducted by in 2016 by Freeman et al. Suggested that lower socioeconomic status is positively associated with higher prevalence of depression. Moreover, established research highlights that the effects of economic hardship, such as depression, usually present at younger ages and will persist through adulthood, which you can kind of see here in this graphic over here. This is also consistent with additional studies that have examined the role of socioeconomic status on the prevalence of other chronic diseases, most often diabetes and obesity. Further, some studies have examined the relationship between income level and substance use disorder. While some have shown that there is a positive correlation between them, there is no clear etiology and there has been conflicting research. Okay, so how do all three of these factors relate? So this right here is Wilkinson's model. It's a model to suggest that may explain the associations among socioeconomic status, depression, and substance abuse. It's explained by the theory of deprivation, which argues that a mediating psychosocial factor, in this case depression, may be part of the causal pathway that links socioeconomic status to health outcomes. As you can see here, depression is the mediating factor, while lower socioeconomic status is independent variable, and substance abuse is the dependent variable. I found this visual to be very enlightening when trying to research this association. So additional information on the association between socioeconomic status, depression, and substance abuse. Research was done by Dagger and Green, where they looked at the Woodlawn study, which recruited a cohort of African-American first graders from Chicago between the years of 1966 and 1967, and they followed them through adulthood. So it was a prospective cohort study that we used to examine this relationship. The analyses that focused on these individuals that were interviewed as young adults and those that were followed up in midlife, so that we got both data points to view and to understand the relationship. The regression analysis that was done in the study that controlled for potential confounders showed that young adults with depression and substance use disorder were more likely to have any period of unemployment, to also have periods of unemployment greater than or equal to 3 months, as well as lower household incomes when comparing to those with either disorder alone or none at all. And again, this shows that there is an association, but not necessarily the causal pathway of it. So this is the regression analysis that was done. As you can see here, these are the controlled variables that they were believed might confound for the results. but we still have significant data being presented showing the association exists. So what the study is showing us is that there is an association between socioeconomic status, substance abuse, and depression. Although in this visual representation, depression is seen as the mediating factor, while in Dogger and Green's study, they assume that depression and substance abuse were what caused lower socioeconomic status. Kind of the other way around in this visual representation. So again, no clear consensus has been made as to what the causal pathway is. We just know that a relationship exists. So what does this mean? The solution. So what does this mean for global mental health practice? So next steps, we do need more research to better understand the comorbidity that exists between substance abuse and depression in general, as again, they couldn't decide a causal pathway. And then again, this research can help to facilitate targeted interventions that are aimed at minimizing effects of mental illness and substance abuse disorder together. This research also highlights that depression and substance use disorder is still a prevalent problem, especially among low-income communities, worldwide and at home, and thus improved mental health infrastructure in urban communities especially is necessary. And then to add on that, more research is also needed to understand the impact of the comorbidity of substance use disorder and depression and socioeconomic status globally. Most of the research that I was able to find for this project was based in the United States, and therefore I think it would be very helpful for public health practice and global mental health to have more studies that were conducted globally in developing countries and low and middle income countries, so we can see if socioeconomic status is a mitigating factor or a result. So thank you very much for listening. I hope you learned something new. I know I did. So thank you and have a great day.